Okay, hello, my name is Jana McDonald. I'm a career advisor at the University of Guelph, most recently supporting students in the College of Social and Applied Human Sciences. Today I'm excited to launch what I'm hoping will be the first of many career spotlights, where we explore different careers that are going to be available to students upon graduation. Specifically, we're starting with the career of a child life specialist. So joining me today, I have two additional panelists to help just spur and further on that conversation. Caitlin Beacock, would you mind introducing yourself?
Hi, I'm Caitlin. I am a fifth year psychology honor student. I'm currently writing my honor thesis this year, and that's me.
Thank you, Caitlin. And Dana Kondo, would you mind introducing yourself?
Hi, everyone. My name is Dana, and I am a certified child life specialist at the Hospital for Sick Children. I am currently the lead for our virtual reality program, and I also provide clinical care on the general pediatric and infectious diseases unit.
That's interesting. You've already sparked my curiosity about that virtual reality piece. So maybe we can explore that further as we go through our conversations. Just to get us started in the conversation, Dana, would you mind sharing with us all what you've been up to since you graduated from the University of Guelph?
Yeah, so just a little bit of background. At the University of Guelph, I did minor in a Bachelor of Arts in Psychology, and I minored in Family and Child Studies. And then after my 4 years at Guelph, I moved on to McMaster's Master of Science in Child Life and Pediatric Psychosocial Care. That was a 2-year program there. And then after my coursework and my clinical internships in my graduate program, I was very fortunate to get a job as a child life specialist at SickKids just a few months after graduation. So I was very fortunate in my career path.
Awesome.
Okay, that's awesome, Dana. Thank you. Caitlin, would you mind starting the conversation with some questions?
Absolutely. So to follow up with that, when you were applying to your future education after Guelph and programs in fourth year, what programs were you looking into and what ultimately made you choose McMaster's child life programs?
Yeah, so I was very fortunate in knowing pretty much from high school that I wanted to be a child life specialist. So my undergrad was very focused on one day becoming hopefully a child life specialist. So the thing about the child life field is that it is a relatively small field. So when I was looking for graduate programs, there really isn't a lot of selection within Canada. So really the only master's degree in our country currently is McMaster's Master of Science degree. You can still become a child life specialist through there's a graduate degree program through the University of Fraser Valley in British Columbia, and you can become a child life specialist independently by doing some online courses. However, usually that's not a route that's recommended just because it's extremely difficult to get a clinical internship if you're not affiliated with McMaster's program. So when I was looking for programs specifically, it was really McMaster's child life program or nothing. I was really focused on looking at McMaster, and I was thinking in my head, maybe I'd give it 2 or 3 times of applying and doing some other things on the side. And then if I didn't get in on like my second or third try, then maybe looking at different opportunities such as speech language pathology or occupational therapy, because those are also really great fields in the allied health profession. But as I said, McMaster's Master of Science is really the way to go if you want to become a child life specialist.
That's super interesting. That's good to know, even as a student wanting to apply. What was the application process like for the program? When did you apply? When did you hear back from them? Things like this.
Yeah, so I'd really recommend going to McMaster's program on their website. They have a specific tab that's just for the Masters of Science in Child Life and Pediatric Psychosocial Care, and it's very comprehensive and lays out all of the steps for you. Usually they start accepting applications in November and they close somewhere around February. I think I heard back from them in March, so about a month of waiting. I heard that I got an interview for April, and usually sometime around April is when they'll start to give the interviews. Typically it's 30 to 40 people that they'll interview in a year, and then they'll accept between 12 and 14 students per cohort. But as I said, if you are really interested, I'd really recommend looking at the breakdown on McMaster's website, because they go into details for all of the things that you need in order to have the application all ready to go, such as your hours of volunteering you'll need. You'll need to have a couple of courses in some sort of child development studies already. You'll need to have passed the English proficiency test if English isn't your first language. So just little details like that would be really great to look over.
Awesome. And just to add to that, as I said, I was looking at the program on November 10th at 9:30 a.m. They're holding a virtual open house for the program. So just to kind of get an idea, it's a presentation, and then more details are coming out. But it starts with a presentation at 9:30 in the morning.
That's perfect. Everything's going virtual now.
Yes. To follow up with that, you mentioned volunteer work, and I was just wondering, how do you go about finding the volunteer work opportunity that you need in the admission process? Because it has to involve, they've changed it because of COVID to not as much involve a child life specialist, but ideally involve a child life specialist. And how did you go about finding that position?
Yeah, so again, as you said, ideally a child life specialist will be able to sign off on the hours that you're doing your volunteer work. My recommendation would be to look into your local hospital and see what kind of pediatric programs they have, and see if there is a child life program. Usually somewhere on the hospital website they'll mention that. If you dig into a lot of hospital volunteering, because almost every hospital is going to have some sort of volunteer program. So if you just contact that volunteer program, usually they can set you up on knowing if there's a child life specialist there. And then if there's a pediatric component, usually you can specify in your volunteer requirements that you're specifically looking for a pediatric experience. I was very fortunate in that I've always lived in the GTA, so SickKids was accessible to me. So SickKids volunteering is where I got all of my volunteer hours. So I just started out there in the general pediatrics unit, actually. And then I did some volunteering in the emergency department, hematology, oncology, the family center. So I did bop around a little bit and make some connections, which is always great. And feel free, if you are volunteering, to reach out to the child life specialists on the units too. Everyone is really receptive to students that are interested in the child life field, and we're always more than happy to talk to you on a one-on-one basis and give you some support and advice.
That's super cool that you got so many different opportunities within the hospital. Now moving kind of further along in the admissions process, what was the interview process like? How did you prepare for them? Do you know of any resources to help prepare with them?
Yeah, so I found personally McMaster's interview process very unique. I hadn't really heard of this before I looked into it, but they have something called a multiple mini interview process. So this is where you usually have a group of about 10 candidates that will come in during the same time slot, and you're rotating from room to room. So about 8 to 10 minute sessions. You'll go in, you'll meet with a specific person. They'll give you a scenario or ask you a question. As I said, you have the 8 to 10 minutes to answer it. They'll tell you time is up. You'll rotate to the next door. You have about like a 2-minute breathing period to kind of decompress. Then you go into the next room, you meet with the next person, and it's a new scenario or a new question. So it is very different than most interview styles where you're sitting down with a single person or a panel of people and they're just asking you questions. This is a little bit more scenario based. I honestly found it a little more comforting because you're while it was very busy, you got to meet lots of people and the scenario component was very interesting. So I'd recommend going to the Association of Child Life Professionals website, the ACLP. They have some really great interview questions and typical scenarios that a lot of people ask. So that would be a really great resource to use. There's a lot of child life programs in the States as well. So if you kind of just do a general Google search for child life interview or internship questions, a lot of the programs from the United States will come up. So I kind of went through a lot of those practice questions that I found online and found the scenarios to be pretty accurate to what was asked in my multiple mini interview rounds.
That's awesome. What elements of your application do you feel that made you a successful applicant?
Yeah, that's such an interesting question because I feel like I got a really good tip when I was talking to a child life specialist before I applied. And she was kind of saying, a lot of the people who are applying to the child life field, of course, they do a lot of volunteering. They're genuinely very caring people. They love working with kids. So while it's still obviously good and important to put that in your application, finding a really unique component of yourself that will stand out is really would be a really great asset. So for example, for me, when I was at the University of Guelph, I actually had a part-time job as a Guelph tour guide. So I'd be showing off the campus, showing prospective students around to like the residences and answering all of their questions. So when I was writing my application and I had my letter of intent, I really focused my letter on my tour guiding experience and kind of linked how being a tour guide was being similar to a child life specialist and how I was here to comfort these children and families in this period of transition, and how I was love to answer all of their questions and be a friendly face for them. And it's kind of not many other people are a tour guide, so I use that as my little unique thing that I could link back to child life. So if you have anything like that that's a little bit unique that you can really tie into how they would be applicable to child life skills, I think it would be a really great thing to put on your application.
That's an awesome tip. What was the coursework, like the course load, like compared to your undergrad?
Honestly, I didn't find it too bad. We only had the way McMaster's program is structured is the first year. So you do have 3 semesters. You don't get the summer off. So the full first year, you have about 3 courses per semester, whereas in undergrad, we usually have 5. And then the second year, we have our clinical internship. So we only have 1 class during our internships because most of our time is obviously in the hospital setting, shadowing our preceptors. So the only, I guess, different thing, although COVID is maybe prepping you for this really well, is that McMaster's program is primarily virtual. So it's almost all online. So that was a little bit of a change for me because I'd previously done all of my classes physically, with the exception of like 1 distance education course maybe. But this is very different because, as I said, this is really the only master's program for Canada. So some of my classmates didn't even live in the province. They're out in Alberta. So I only got to see them on the little square when we had our live classes and we had this virtual setup. So I'd really recommend working on your time management skills because you're going to kind of be structuring your classes yourself. There's no professor hovering over you. So you really have to do a lot of the studying on your own time. But that being said, I found it very manageable. I did have a part-time job through my master's as well. So I worked as a customer experience representative at Indigo, the bookstore, because I love to read. So I still had my shifts at Indigo. I had a couple per week, and I was still able to manage that with my course load, no problem.
Just a follow-up to that, you said it was virtual when you went in the program as well. Is it mostly live classes or are they pre-taped? Because right now, obviously in undergrad, they're a mix. So what can be expected of that?
Yeah, good question. So all of our classes were live. So we did have our professors teaching us live, so we had the opportunity to ask questions. But then, as I said, we kind of, I guess the nice thing, we had pretty much our schedules laid out before us, all the classes kind of coordinated, so we could see all of our assignments coming up, everything we had to do. So while we had those live classes, there was still a good amount of reading and personal assignments that you kind of have to work into your schedule yourself because they won't be included in those set times that you have for class. But the live classes were nice because then you did get the chance to really talk to your classmates, get to know them. The professors are really great in the program too. I can't stress that enough. They're very supportive. They're very welcoming. And we always knew if we had extra questions or needed to stay on the class for a few minutes after class had technically ended, they were always willing to give us the extra support.
That's really great to know. Thank you. What were the residence experiences like? Do you think they gave you a good sense of what you're doing today?
Yes, 100%. So my first clinical internship was at Grand River Hospital in Kitchener. So that's a general hospital, and they have a small pediatric unit. It's about 12 beds, and they have a Pogo satellite cancer clinic as well. So I had a really great experience there with just how a pediatric unit works in a general hospital, how a child life is utilized. And then my second internship, I got in the critical care unit and the cardiac unit here at SickKids Hospital. So a very different experience, a much larger team, much more complex cases. So it was a really good variety. So that is something I'd recommend for internships. If you do have the opportunity to have a general hospital and a pediatric hospital, or just to really vary your experiences, even if you think you want to work with a specific population, be on a certain unit, or even if you think that a general area like isn't for you, I'd still recommend giving it a try and being really open, because when you get there, all of the experiences are so valuable. And really being open to your different internships as well, because it is an interview process. So typically you're going to be interviewing with 4 different places, but it's a matching process. So bless our internship advisor's heart. She works really hard to make sure that both the institution and the student are happy with where they get placed, and it's going to be a good match for the learning needs and the preceptor style. But just being open to moving anywhere as well, even if you're based in Ontario, you could have the opportunity to move out to Winnipeg or Prince Edward Island. So really being open to all of the amazing opportunities and knowing that really, truly, no matter where you go, you're going to have a great learning experience.
I didn't know that it was a matching program, so that's really good to know. You were able to get a position at a very coveted hospital, loved by many sick kids. What was your application process like for that? Why do you think you were so successful, and how quickly did you go about getting this position after you graduated?
Well, first of all, thank you very much for just pumping up my ego a little bit there. That's great. But second, I guess the application itself was, really similar to any other job. I was just keeping an eye after my graduation, or after my classes were finished. I was keeping an eye on any child life jobs that were going up across the country. So SickKids had a job posting like any other on their career site. So I applied for that online. I had my interview, and I was lucky enough to obviously be accepted for the position. Again, I was pretty fortunate in how quickly it happened. Actually, I think it was maybe 2 or 3 months after my classes had finished. So after you finish your classes, you do still have to write your certification exam. So basically, McMaster's program is making sure that you have everything necessary in order to sit the certification exam with the Association of Child Life Professionals. So as soon as your classes are finished, you book your certification exam. I think it was maybe like November 3rd that I booked it. So literally the day that I got my certification exam, I also got accepted for my job at SickKids. So it was a very quick process, and it was a very exciting day for me. So I got certified and I got a job. And probably one of the things that made me successful as well was even after I finished my internship in the spring, I still kept very close ties with my preceptors. So I would still chat with them, ask them for advice, keep them updated on what was happening with me. So when I did apply for SickKids and I needed a reference, I had a very strong reference because my preceptor knew me very well. I kept in touch with her throughout the process. So that would be my recommendation as well, as just to keep your preceptors close, because they're definitely going to be a benefit.
Excellent. What is your typical day like as a child life specialist?
This is a really good question, but there's truly no answer for it. I don't think there's such thing as a typical day for any child life specialist. One of the things too, it is very dependent on where you work. Whether that's in your setting. Well, obviously most of us are in hospitals. There are a lot of child life specialists that are branching out. They're working in the community, they're working in hospices, dental offices. So it's kind of nice that child life is starting to creep into some more areas, which is fantastic. I'll just give you an example of my experiences of my daily child life tasks. So I'll go into a little bit more of specifically what my job is as well. So I mentioned at the beginning that I'm the lead for the virtual reality program here at SickKids. So the virtual reality program is actually a brand new program that they specifically hired me to try to incorporate virtual reality into clinical care across the hospital. So I came in, and really they wanted a child life specialist to do this because they thought that would be great. Like, we help children cope in the hospital. This would be an amazing tool. So I've come in and I've had to make all the protocols and procedures for who can use virtual reality, what would be benefit for And I'm still currently the only person trained to give virtual reality, but the hope is we're making some iLearn modules, and I'll be able to train multiple clinicians throughout the hospital so that virtual reality will be available to children. So we use it for distraction, isolation, and procedural support. So especially during COVID, this is really relevant because there's a lot of children, even more than typical, that are in isolation precaution, which means they cannot leave their room. We don't want these things to spread. So it's very challenging for a lot of kids, obviously, to be in isolation. So having the opportunity to bring something into them, virtual reality, to make them feel like they've left their room for a little bit. They forget where they are. They feel like they're in a whole other world, is really great for their mental health and just to give them a break from the hospital for a little bit. We use it for distraction as well. So some children just don't cope as well with being in the hospital, whether they have anxiety, if they have pain related to their diagnosis. I like to use virtual reality for non-pharmacological pain management. So just bringing it in, and there's a huge mind-body connection, obviously. So being able to distract these children and provide them with just a fun, novel activity is very rewarding. And then lastly, we do procedural support as well. So one of my big ones is POPEs, so blood work or IV starts. Obviously, kid likes to do that. So I personally like to couple my virtual reality with Max Lane cream, a numbing cream, or cold spray. And then again, the mind-body connection is huge. So this distraction aspect is great. So I've literally helped children who are so anxious around needles, but we put the numbing cream on, I put some virtual reality on them. And then I've had kids say to me as they're in virtual reality, when are they going to do the Pope? And I'm like, kiddo, it's over. Like, I'm just letting you watch virtual reality now. We did it. So it's so great. It just lowers their anxiety, and it's great overall. So a large part of my day is I get referrals throughout the hospital to go do virtual reality with specific kids who need it. So I work with my child life team. They identify children on their units who might be benefiting from virtual reality, and I'll go do these referrals. And then I also provide clinical support on our general pediatrics and infectious diseases unit. So I work with another child life specialist. We share these units. So we do clinical rounds in the morning. We hear all the updates on the kids. We see what procedures are happening. We hear if there are any social situations. So we kind of prioritize which kids would be who need child life support the most. It's a lot. We have, I think today on my unit, I have 60, 70 kids. So there's no way I can see everyone in one day, but if I know that there's a 6-year-old who's really anxious and has an MRI today, I know that's the top of my list. That's a child I can go help educate them on their MRI, give them some preparation, make them feel more comfortable, things like that. So as I said, there's a lot of stuff that Child Life does. We do a lot of play, normalization, education. I love a good slime session with some of my kids just to help them relieve their anxiety. So it's really great. It's a lot of fun.
You mentioned so many things that I would have loved, like the numbing cream and virtual reality to get blood work. My parents will attest that I was the worst child to get blood work. So that would have made the world of a difference. What is the best and toughest part about working as a child life specialist?
Yeah, so I think the best and toughest part all wrapped up in one is like all of the kids that I meet. It's definitely the best part because, oh man, like I genuinely feel like I learn something from almost every kid. I'm so proud of their accomplishments. I'm with them through some of their toughest times. So watching them grow and develop throughout their stay is just so rewarding. I get to make the best relationships. Part of the thing I love about being child life is I really can come in sometimes and be their friend when they don't have that in the hospital. Especially right now with COVID, we have so many visitor restrictions. Their siblings aren't allowed to come see them. Their friends aren't allowed to come visit them. So nurses are really busy. They have to go give their medications to their other patients. So when I come in and I say, hey, like, do you want to make some slime with me and we can have a nice little chat? It's really rewarding to see how well that some kids can respond to that. That being said, it can also be the toughest part of being a child life specialist because you do make these great bonds with kids. And again, depending where you work too, unfortunately, the outcome isn't always as great as you're hoping for. So it's very challenging when you have, for example, a patient who you've made a great bond with who passes away. We're humans too as child life specialists. So you have to be professional, but at the same time, those losses hurt you as well. So self-care is a huge part, I think, of being a child life specialist, knowing your own strengths and limitations, knowing how to debrief at the end of the day, leaving your work at work, and knowing that you can go home and you have a safe space and you have maybe meditation or mindfulness, I think would be a great strength to have as a child life specialist.
I didn't consider the limitations of like siblings visiting and things like that right now too. That would be definitely tough. What client relationship have you developed that you're most proud of, and why?
Whew, what a loaded question, Caitlin.
I'm sorry.
Well, as I said, I touched on this in my last answer too, but man, I'm so proud of all my kids. Like every single child, even if they're a challenging child, I'm still so proud of them at the end of the day, and they're going through some really tough times. So I genuinely feel like I learn and appreciate all of my kids. I would say that one patient who really stood out to me this was back when I was a volunteer, actually. So one of the first kids I ever volunteered with, a nurse had asked me to go sit with him to provide the parent a break. He was like a 6-year-old. He was a complex child, nonverbal. So she's like, he won't really like respond to you, but go read to him or something so dad can go get a coffee. So me as a new volunteer, I'm like, oh, okay, I'll go read him a book. So that first session, I kind of just sat with him and read. But as I continued volunteering and I kept going back day after day, I really started to like talk with him and play with him. And I realized, I think there's more to this kid than maybe some people assume. And I really got to develop a strong bond. I'm like, oh yes, he definitely understands me. Even if he can't verbalize back to me, he knows what's happening. He's so smart. He's so intuitive. And I really had a great bond with him. And I was pushing him down the hallway in a wheelchair one day. Again, this is long pre-COVID, and his sister had walked onto the unit to come visit. So she had said, oh, hi, like, who was the friend that you're playing with? Oh, that looks so nice. And he actually said my name. And again, a little bit hard to understand, but the way he said it, I'm like, no, he definitely just said Dana. He knows my name, and he was able to say it, even though he's labeled nonverbal. So that was a huge turning point for me, because I'm like, you know what, from here on out, every single child, I'm going to go in there and assume that they're fully capable, they're fully knowledgeable. Like each child is smart and understanding and has something to offer. And I'm not going to have any oversights with these children. So I'm really grateful for that experience with that little boy, because really I do think about him every single day, and he drives me in my work now to make sure I don't underestimate any other children.
That's an amazing story. So just to kind of wrap it all up into one last question, do you have any recommendations for students looking to apply to this program, or still trying to figure out their plans for graduate schools in general?
Yeah, so I mean, regardless if you want child life or something else, I think my recommendation is make sure you find something that you're passionate about. I mean, really, you're going to be doing this hopefully for the rest of your life. So give it some thought. And if you don't know what you want to do yet, that's fine. Play around, like keep exploring. Honestly, we're still young. We still have some time to explore. I think particularly in the child life field, but hopefully for anything you're doing, I really do think you need to be passionate about the work that you choose. I'm so fortunate that every day I come to work, I genuinely love what I do. I can't wait to see my kids. I have great colleagues, and this is just something I just really, really love doing. I actually had a parent yesterday who was asking me, I don't think they really understood what child life was. And they're kind of asking, so what are your career goals? Like, what are you doing next? And I'm like, this is it. Like, I'm doing this until I retire. I have the best job ever. Why would I leave that? So I'm definitely passionate about it. So it helps me get out of bed and come to work every day, because I love what I'm doing. So that would be my advice, is really find something you love.
Yeah, that is wonderful, Dana. Thank you for sharing so much there. It was really interesting to learn. Starting with just even applying to McMaster and how far you came in that journey. It is kind of funny. Somebody was like, hey, what are you going to do next? And as far as a career path, I love that. And you really did give a lot of really strong insights, I think, for both applicants to the program. And then also just different insights into the hospital setting itself and what that looks like, which is also beneficial as people are kind of exploring ideas and seeing if it might be the right fit for them. So thank you.
Thank you.
And as a second part to our conversation, when I was setting up this conversation with Dana and Caitlin, Caitlin had shared with me that when she was younger, she also, her and her family, worked directly with a child life specialist. So I thought it would be interesting to share her perspective on what it was like for her family. So Caitlin, could you just set the stage a little bit and let us know the context and what was the situation that allowed you to interact with a child life specialist?
Yeah, absolutely. So I was born with a disability called acampomelic dysplasia. I now say that 10 times fast. And basically, in short, my spine is extremely curved. So a lot of times when I interacted with a child life specialist, it was before extensive spinal operations and just trying to work through basically pre to post-op and the recovery process in its entirety.
Okay. And what was that experience like working with a child life specialist? Oh, Caitlin? Oh, there we go.
It was an invaluable experience. I mean, the person that I worked with, I was fortunate enough to work with through many of my operations. So we, like Dana said, built that friendship bond more than anything, and we were able to talk through the seriousness of the surgeries and what was to come. And as many of my friends who are also disabled and I can attest to, in a hospital, you grow up much faster than normal. You learn all the medical terminology. You have to know what's happening so that you can prepare. And Alexis was my child life specialist. She built that friendship with me and just gave me that reassurance that I could do it and I was supported and the needs and the desires that I wanted throughout the entire operation and post-op, I was gonna get. She was gonna support that. And again, for my parents, it was another support that addressed their concerns and had their questions and got their answers for them so that everybody was on the same page going into the operation so that the whole process was smooth. And as a patient, in post-op, I wanted to get home very quickly, and that was just who I was. So she helped ensure that process kept going. I did the things that I need to do, sat up in a chair, went down to the cafeteria, grabbed a meal, and then went back to bed. Like the progression of making sure that I could go home was invaluable, and knowing that I was continually moving forward and going to get through that process.
Yeah, that's interesting. And interesting as well, just nice to also hear about that support that's being able to give to the parents as well and getting some of their questions resolved. That I'm sure is a very supportive environment for them as well. And would you recommend, Caitlin, that others work with child life specialists? I think I know the answer, but I'll let you decide.
Absolutely, they're an invaluable asset. My parents were 24 when they started this health kit, which is crazy because I'm 22 to think that they started this 2 years in the future for me with my healthcare journey. So to have that advocacy, the friendship, the support to continue in a healthcare team and have that person on your team throughout your entire journey is, like I said, invaluable. And it definitely, and it helps make the transition and the operation and the transition into the hospital, operation and transition home, all kind of easier because obviously what you're there for is very, very monumental and ginormous. So to have that someone else to kind of be like, okay, you're gonna get there. It's just however long it's gonna be. We're gonna take it day by day. It's again invaluable.
Yeah, it's an amazing journey that has brought you here today, right? And that just speaks to me of how important that person's role potentially was in your life, that you're now kind of considering it yourself as a career pathway. Yeah. So thank you, Caitlin. I know it is like middle of October, and that means like midterm exams and papers due, and I'm sure, Dana, you can remember those days. So Caitlin, I appreciate you joining me today and taking that time. And Dana, Caitlin and I can't thank you enough for joining us and volunteering to help us out with this today. It's going to be really helpful for Caitlin as she prepares for that application process, and other students as well. And I just want to say how grateful I'm speaking on behalf of myself, but the University of Guelph and everyone for the work that you are doing at SickKids. It seems like such a rewarding career, and what a meaningful way to touch children's lives and families' lives. And thank you for taking a bit of your time away from some of those kids. I was feeling guilty as you were talking about your course caseload earlier. So I'm so grateful that you did take the opportunity to help future child life specialists. So thank you so much for that.
Oh, thank you so much for having me.
Thank you so much. I learned so much from you, and it was great to have a perspective of a past student and answering the questions that I'm really facing today and trying to prep for my application. And Jana, thank you for asking me to be a part of it.
My pleasure. All right. Well, thank you, everyone. Have a wonderful